Hello, guys. Today we are going to talk about the speaking section in the OET exam. So please listen to me carefully because I'm going to read every single information, and all the information that we have is really important. So what about the speaking section in the OET exam? Let's talk about the overview. The OET speaking test is a face-to-face examination between an interlocutor and you. Your speaking test will be specific to your healthcare profession. In this book, we will cover medical and nursing topics. In the speaking test, you will complete two role plays where you take the role of the healthcare professional and the interlocutor takes the role of the patient and the carer, or maybe the carer or family member of the patient. Now, what about the strategies that I have to apply to get a good band? One, treat the role play as if you were with a real patient. Allow time to establish a relationship between or with the patient and ask for relevant information. Remember that the assessor is testing your ability to communicate effectively with patients in English. So they are, sorry, they are not testing your medical knowledge. Pay attention to the type of the information you need to communicate to the patient and adjust the way you communicate this information for different situations. If the patient is being given bad news, for example, you should show empathy and kindness. So don't memorize long answers. Anything the assessor thinks has been memorized will not be assessed. So please avoid memorizing because, guys, I think you will hesitate in speaking if you want to memorize and you will forget most of the information. So please, guys, avoid memorizing. You have to speak clearly, spontaneously, naturally, just to get a good band. Use varied vocabulary which matches the needs of the patient and the context of the role play. You need to show you can communicate with the patient in a variety of ways. Speak loudly, speak clearly and confidently, so the interlocutor can hear you. So please, guys, this is really important. And I need to tell you something that you have to avoid this language. Please don't say wanna, gonna, for example, gara, because this is really wrong and this is formal exam. And guys, you have to pronounce every single word clearly. Okay? Let me give you an example. Some students, for example, pronounce this word as swimming. They don't pronounce the G at the end of the word. Please avoid that. You have to pronounce the words clearly. You have to say swimming. This is extremely important because, guys, this exam is formal exam. It is not informal exam. So vary your intonation. Your voice should rise and fall as a native speakers would. So please, guys, especially if you are using or if you are talking about surprising information, if you are asking questions, please, you have to be careful about your intonation because sometimes the intonation should be up and sometimes the intonation should be down. Okay, so read the role play card carefully so you don't misunderstand or miss out on any of the topic or bullet points. Make brief notes for each point on the card, include ideas and examples, but not in full sentences. Because, guys, you don't have time just to write every single answer or to write everything. Because In writing or in taking notes, I have to write all the keywords, all the phrases, and then you can go into details when talking, because you don't have time just to write everything you need or to write every answer of every question. This is really bad. Now, try not to be nervous. Take a deep breath, smile, and make eye contact as you begin your speaking task. While eye contact is not assist, but it can help you to feel more confident. So, underline keywords and phrases on the card to assist you, to help you with the role play. Don't be afraid to ask the interlocutor to clarify anything on the role play card which is unclear. This is extremely important. So don't be afraid or shy. For example, you have to ask for clarification, because guys, if you answer a question which maybe the answer is totally different from the question, and because you misunderstood the question, absolutely your answer would be completely different, and this is something really bad. This can include the meaning or pronunciation of vocabulary and the context of the role play. So please don't hesitate to ask the interlocutor everything you need. So ensure that any questions are asked before the role play begins. This is really important. Okay, now I think we have to talk about the speaking task. Now, by the end of this class, we will analyze the role play card, practice strategies for the speaking test, and assess your own speaking. Now, the introduction. The speaking test will take approximately 20 minutes. You will complete 2 role plays and will talk to the interlocutor for 5 minutes during each role play. You will have 2 to 3 minutes to prepare yourself, to prepare for your role play using your role play card before each role play begins. You will outline criteria that will be used to assess your speaking test in this chapter. When completing speaking tasks, make sure to keep the criteria provided in mind and try to demonstrate your abilities in each individual section. So we will give examples for how these criteria could be addressed in the speaking exam. However, we don't advise students to try to memorize these examples or attempt to reproduce them word by word on the test day, because this is really wrong. And absolutely, the interlocutor will know, guys, if you are or if you memorized any information, and you will not be able to speak naturally. And the last thing, you will not be able to memorize or remember, let me say, you will not be able to remember everything. So this is why memorizing is something bad. Now, these strategies, getting ready to speak. The first step in the speaking test is to familiarize yourself with the role play card. You will only be given one role play card at a time, and you will not be given the interlocutor's role play card. Be aware that the interlocutor's card will include information that is not included in your role play card. So the card you are given will not fully prepare you for everything the patient will say. So although it should give you a good idea of the outline that the conversation will take. So below are 2 role play cards. I'm going to show you guys 2 role play cards. One is medical role play and the other one is nursing role play. Select the most appropriate role play card and use it to work through the following strategies. Let me show you guys the cards. And absolutely, we have to practice these cards. So these are the two cards I have already prepared. The two cards. Please, guys, stop for 1 minute just to take a look at these two cards because we have to practice them later. So you can pause the video just to read the information. And I think we have to complete. So this is about the setting, doctor, the task, setting, nurse, the task, because this is the nursing task, and this is the medical task. So these are the bullet points that we have in the task. 1, 2, 3, 4 bullet points in the medical task, and 1, 2, 3 bullet points in the nursing task. So please, I have to read every single information clearly. And as I told you, pause the video for 1 minute just to be able to read the information that we have in these two cards. Okay. Now, who is the patient? Now, the first thing you should identify is the type of patient you are going to talk with. Role play cards will inform you of the key details about the patient and the reason for the appointment. You may also be told about the patient's emotions. You should take all of these pieces of information into your consideration and plan your approach accordingly. Accordingly. For example, if a patient is nervous or worried about a procedure, you will need to offer them reassurance. Please, this is really important. Okay, now let's talk about this exercise. Now match the following three patient descriptions with the most appropriate approach. Listen to what they have to say and find out what the patient wants to know. Explain carefully, perhaps multiple times, while checking for understanding throughout the explanation. Briefly outline the options available and recommend the optimal course of action. So, number one, an 83-year-old needs an MRI scan and seems confused. 2, a 56-year-old has terminal cancer and is extremely upset. Now 3, a 24-year-old has a viral infection and is impatiently requesting a treatment. So look at the description of your patient in the role play card on the previous page. So we have to look at the patient, at the card that I have just shown you. So I have to take 30 seconds to consider how to best complete the tasks and bullet points as I told you, and make a brief notes below. So think about the language required to check for understanding. So this is it. These are the two cards. So let's try to take a look at the two cards that we have. Let me try to show you the questions again. As I told you guys, you can pause the video and you can zoom the page in just to be able to read every single information. So this is it exactly. So you can read again and try to check the information that we have. So this is number one. wait. This is number 2. This is number 3. So please, we have to look now at the description of your patient in the role play card on the previous page, and you have to have 30 seconds to consider how to best complete the tasks and bullet points and make brief notes below. So think about the language required to check for understanding. Okay, so now let me complete. Now, what do you need to find out? Let me zoom the page in and let me complete reading. So what do you need? Okay, what do you need to find out? So next, look at the bullet point tasks. At least one of these tasks will ask you to find out information from the patient. Identify what it is that you need to find out from the patient and think of ways to rephrase the task into a question and would be appropriate for conversational English. Absolutely, I have to paraphrase. I shouldn't, guys, copy every single information in the card because this is really bad. Take another 30 seconds to think about rephrasing the information in the first bullet point of your role play card to turn this into appropriate questions. Your initial question should be an open question. For example, how are you feeling? Which should then be followed up with more closed questions. For example, how long have you been experiencing these symptoms? So again, this is it. These are the 2 cards. You can pause the video if you want, as I told you, just to take a look at them and try to form open questions about the bullet points. Let me go back. Okay, now what do you need to tell the patient? So you will be required to provide your patient with necessary information about their condition, tests, and course of treatment, and should ensure that the patient understands the information. What you need to communicate to the patient will be outlined in the bullet points of the role play card. You may simply need to explain a point to the patient, or you may need to find out relevant information first before tailoring your response to the patient's individual case. If you have a lot of information to communicate with the patient, you should break the information down into sections and chunks so that you can check the patient's understanding of each section of information before moving on to the next section. Now, speaking in English. Once your planning time is up, you should have a good idea of the structure your conversation will take. When speaking, you need to cover the following 4 linguistic to make sure that you are showing the assessor your ability to interact effectively. Let me show you guys the 4 linguistic that we have because these are really important. So number 1 is intelligibility. Number 2 is fluency. Number 3 is appropriateness. Number 4, this is it. Okay, let me scroll down a little bit. Okay, and number 4 is resources of grammar and expression. So these are the 4 linguistics I have to consider. Let's talk about the first one. Or let me complete reading, then absolutely we will talk about them. So the following for linguistic, to make sure that you are showing the assessor your ability to interact effectively. You need to show that you can have meaningful conversations with others in English. You should communicate confidently. Take control of the interaction. Lead the topic of conversation and effectively complete the speaking task. By addressing all the options in the task card and responding appropriately to the patient. While it's not essential that you cover all the information in 5 minutes, well, that is provided for each conversation, you should not waste time to talk about points not mentioned in the role play card. Now, intelligibility. Intelligibility, guys, is about to score well in the criterion. Now, let's talk about intelligibility, as I told you. To score well in this criterion, you need to communicate in a way that can be easily heard and understood. The assessor will pay attention to your pronunciation, the rhythm you use when you speak, the stress you put on individual words, your intonation, and your pitch. All of these are really important. Avoid memorizing, as I told you, large chunks of speech before the test, as this will sound unnatural. Instead, speak at an appropriate speed and clearly allow your voice to rise and fall. Guys, you don't have to speak really fast because you will commit mistakes. And absolutely, you don't have to speak slowly because you will lose your time and time is going to finish without fully answering or completely answering or covering the important information in the card or in the card. So please, this is very important. Practice pronouncing words in English so that they sound the same as when a native speaker or a native English speaker says them. Now, to address the first bullet point task in the nursing role play card, you could say, for example, so this is the first bullet point in the card, in the nursing card. This is it. Find out if the patient has had any issues complying with the medications or exercising or eating healthily. So now you could say, tell me if you have had any issues following the diet that we discussed at your last appointment. So notice that the words that are shown in bold in the sentence above should be stressed, as they are the words which carry the meaning in the sentence. Keep in mind, guys, that all nouns should be stressed. The verbs shall not be stressed, except for main verbs, like go, run, sleep, drink, watch. All these verbs are called main verbs. You have to stress them, but you don't have to stress the other verbs like verb to do, verb to have, verb to be. So you don't have to stress them, but all the nouns and adjectives should be totally stressed. So the word shown should be stressed, okay, meaning which carry the meaning in the sentence. Stress is a slight increase in volume and a slight increase in the sound length. So, for example, you have to say, tell me if you had any issues following the diet that we discussed at your last appointment. Now, let's talk about fluency. This criterion addresses the rate and flow of your speech. You need to speak at an appropriate speed and carefully think about the sentence you are going to say before saying it, rather than saying something that you later need to correct. Please, this is really important. You have to be totally ready before speaking. And guys, if you consider any mistake later, correct it immediately. Again, if you commit any mistakes, please correct them. Do not ignore them, because absolutely they will affect your score. So you should avoid overusing filler noises where possible, such as um, um, so please, guys, this is really bad, because as I told you, you have to speak naturally, spontaneously, and focus on speaking smoothly, linking your speech together. This is the correct connecting of words and sentences, and pausing appropriately. You have to consider, guys, the commas, the full stops, the colon, the semicolon. So please, because pausing is really important. You might pause to separate different points you are making. You should say, for example, first, notice that I have to pause after saying first. First, we need to address your diet. Then we can look at more invasive treatments. So please, guys, you have to consider the punctuation marks and pause, because this is really important just to be natural in speaking. You can also pause for emphasis or before beginning a new task on the role play card, giving yourself a moment to think about what you will say next. This is really important just to avoid committing mistakes. Now, appropriateness. Now, this criterion assesses the appropriateness of your language and tone. Remember that you are speaking to a patient, not a medical or professional, so you should explain any terms that they might not understand. For example, you would rephrase hypertension in the role play card to, for example, high blood pressure. Or another example, insomnia. Maybe, guys, the patient doesn't know the meaning of insomnia, for example. So you can paraphrase this by saying the inability to sleep. So this is paraphrasing. This is really important just to make the information easier to the patient to understand. Your language and tone should also remain professional and confident, and you should adjust your tone to match the emotion of the patient and the topic being discussed. Now, resources of grammar and expression. You need to show that you can use grammar correctly and speak in a variety of tenses and tense structures. Absolutely, tenses are really important, and sentence structures are really important. Please, guys, while speaking, you have to use the 4 kinds of sentences: the simple sentence, the compound sentence, the complex sentence, and the compound complex sentence. And please, guys, you have to use conjunctions, because in this way, your words, or maybe you can, in this way, if you want to do that, you will be able to speak in a professional way, and your speaking will be flow. Okay. Now, you should use grammatical devices such as chunking to make your speech clearer and easier to understand for the patient. If you are giving the patient a large amount of information, you might say something like, I am going to discuss the various options available to you. The first thing is, so notice that how to make the things easier to the patient. So the first thing, the second one, the third one, then And guys, let me tell you something which is really important. Avoid using contractions in speaking. Because guys, contractions is informal, is something informal because the OET exam is completely formal. Please avoid using abbreviations or contractions, not only in speaking, but also in writing. Now, you should show that you can communicate information in a variety of ways. You might rephrase something you have already said to make sure that the information can be understood by the patient. Make sure that you are using the correct word order when speaking, please. Don't omit words from the speech. You should use the correct tense when speaking. This is extremely important to make sure that the patient knows if you are talking about something maybe in the past, something in the present time, or maybe something in the future. So absolutely using the correct tense is extremely important. So this is it, something that you will do, or maybe something happened in the past, in the present time, or maybe in the future. Speaking with the patient. Now, as OET is a test for healthcare professionals, as well as having a good command of the English language, you also need to be able to communicate effectively and responsively with the patient. There are 5 clinical communication criteria which you will be assessed on. So guys, let me show you the 5 clinical communication criteria that we have, because we have to talk about them one by one. Number 1, the first criterion is relationship building. The second one is understanding and incorporating the patient's perspective. 3, providing structure. 4, information gathering. Finally, 5, wait, please, information giving. So these are the 5 criteria that I have to consider. Absolutely, we have to discuss them one by one. And I think we have to start with the first one. Okay, let me go up to the point that we have stopped. Okay. Please, please, please. Okay. So there are 5 clinical communication criteria which you will be assessed on. You don't have to address all parts of each of the 5 criteria to score well in speaking test. So it's not a must to apply them all, but at least you have to apply 2. Now, relationship building. Initiate the interaction appropriately. You should start with an appropriate greeting. From the beginning of your interview, you should make the patient feel welcome and at ease. Begin by introducing yourself, then give your role and explain or remind the patient why the appointment has been scheduled. The following gives an appropriate example of a greeting. So let me read this example of a greeting for you. Hello, I am Dr. Albert. Is it Margaret French? I am one of the rheumatologists attached to the hospital. Your family doctor has asked me to see you about the joint problems you have been having. So notice the greeting, and guys, notice the intonation, especially if you have questions, if you have surprising information, the intonation is really important. Now, demonstrate an attentive and respectful attitude. As the interview progresses, you should make sure to show that you are paying attention to the patient's needs and concerns, and show that you are listening to what the patient is telling you. This will help you to create a collaborative environment, between you and the patient, and allow the patient to feel at ease with you. To meet these criteria, you could ask for the patient's permission to discuss topics that could potentially cause them to feel uncomfortable. Check that the patient is comfortable with what is being discussed if there are any signs that they may not be, and show sensitive, sorry, sensitivity with discussing anything that the patient may find embarrassing or personal. The following is an example of how you might demonstrate respect for the patient. Let me read the example for you. Now, what I would like to do is spend a few minutes with you now discussing your symptoms. Okay, so notice that this is a question. I have to say, this is not a question. I have to say, what would I like to do is spend a few minutes with you now discussing your symptoms. This is not a question because this is a normal sentence. So I have to say, what I would like to do is spend a few minutes with you now discussing your symptoms. Is that okay? Now, this is a question. My intonation should be up. Is that okay? Please let me know if you are feeling uncomfortable at any time. Now, demonstrate a non-judgmental approach. Now, when the patient shares information, you should accept this information without reproach or judgment. Don't devalue or criticize the patient when they share their thoughts or behaviors, as this will discourage them from continuing to share information with you. You need to maintain respectful communication. So you should acknowledge the patient's emotion wherever possible. The following gives an example of how you might respond to a patient who has voiced concerns. So, what worries you most is that the abdominal pain might be caused by cancer. I can understand that you would want to get that checked out. Now you have to show empathy. Wait. Okay, no. Okay. Now show empathy. You should show the patient that you understand why they feel a certain way. If they are emotional in your interview, you should also be prepared to change your approach. If there is an emotional element to your interview, for instance, okay, if you have to break bad news, this is for instance, you can show that you are meeting these criteria through your words, but you can also show empathy through the tone of your voice and through nonverbal sounds of agreement, sympathy, and encouragement. You should demonstrate your empathy for the patient by saying something like, you mentioned earlier that you were concerned that you had angina. Angina is a very particular kind of pain, which relates to several underlying conditions. Is it all right if I ask you a few more questions to roll out muscular pain. So this is an example. And let me read the second example. I can see that your husband's memory loss has been very difficult for you to cope with. I imagine I would feel similarly if the same thing happened to me. Now, understanding and incorporating the patient's perspective. In the speaking test, you need to show that you're putting the patient at the center of the conversation, planning your speech around how you expect the patient to react and modifying your speech if they react in a different way. Follow the next three steps, okay, to make sure that you are using the information your patient provides to alter your conversation. One, elicit and explore the patient's concerns. Encourage the patient to give their thoughts and opinions about their condition. Don't simp don't simply don't simply sorry don't simply ask them to list their symptoms but also explore what they think might be the cause. For example, you could say, did you have any thoughts about what might be causing your symptoms? Or to get an idea of what the patient might be feeling, you could say, was there anything particular you were concerned about? Now, if the patient has not explained something fully, or you want to explore something further, you can do this by saying something like, you mentioned that you were concerned about the effect the illness might have on your work. Could you tell me more about that? Now pick up on patient cues and react accordingly. Alongside encouraging the patient to provide information, you will also need to show that you're taking this information into your consideration and shaping the conversation around what the patient is telling you. Many test takers do not score well in the speaking test because they try to follow a specific structure for the conversation, which they don't adapt and alter according to new information provided by the patient. So please, this is really important. Don't memorize long dialogue, as we said, to use on test day. Instead of that, practice reacting to new information and incorporating it into your speech. When reacting to emotional patients, you might say something like, you used the word worried. Could you tell me more about what you are worried about? Or when patients show emotions or emotion, but don't tell you that they feel a certain way, you could say, for example, I sense that you are not happy with the explanations you've been given in the past. Now, so now relate your explanations to the ideas, concerns, and expectations you have elicited from the patient. To show the patient that you are using the information they've given to you to structure and guide your speech, you should let the patient know that their words have been heard. If a patient gives you or gives new information that changes the structure of your conversation, you could indicate this by saying something like, as you say, you're having trouble sleeping at the moment. Let's talk about things you might help you address this before we move on. Now, if, on the other hand, the patient provides information that doesn't alter the conversation, you can still acknowledge their input by saying something like, you mentioned earlier that you were concerned that you had angina. Angina is a very particular kind of pain which relates to several underlying conditions. Is it all right if I ask you a few more questions to roll out muscular pain? Now, the next one is provide structure. So sequence the interview purposefully and logically. You should structure the interview clearly and efficiently. Begin by greeting the patient. Discuss why they are seeing you today. Then tackle each bullet point one by one. After you have provided an explanation, you or completed a series of questions, check that the patient has no further questions and has understood you before moving on. While making notes on your role play card in the preparation time, look through what you have to talk about and think about how you might connect the bullet points to one another in your speech so that your speaking flows logically. This relates to signposting. Okay, now signpost changes in topic. Signposts function as a pause between topics and allow you to check for understanding and ask for permission to discuss topics. They also allow you to summarize information given by the interlocutor. This relates to later criteria. This is when moving from one topic to the next one, you need to make it clear to the patient that you will discuss. After greeting the patient, you should outline the topic that will be discussed before getting into details. Whenever you move on into a different topic, tell the patient that you are moving on to talk about next. So you might start to discuss a topic by saying something like, something like this. Since we haven't met before, it will help me to learn something about your past medical history. Can we do that now? Now, after a patient has finished telling you about something, you might outline what you want to discuss next by saying something like this. You mentioned two areas there that you mentioned two areas there that are obviously important. First, the joint problems and the tiredness. And second, how you are going to cope with. So, how you are going to cope with your kids. Could I start by just asking a few more questions about the joint pains, and then we can come back to your difficulties with the children. So let me read that again because I have to adjust my tone. So you mentioned two areas there that are obviously important. First, the joint problems and the tiredness. And second, how you are going to cope with your kids. Could I start by just asking a few more questions about the joint pains? And then we can come back to your difficulties with the children. So absolutely, we have to consider the punctuation marks. We have to consider the tone because they are really important. Okay, now signposting any changes in topic helps the patient to keep track of what's being discussed and gives a clear structure to your discussion. So now use organizing techniques in your explanations. There are a number of different ways that you might organize your explanations. Again, your primary concern when organizing your explanations should be to make your speech as clear and digestible to the patient as possible, to help the patient understand and to make it easier for them to remember information discussed at a later date. It can be helpful to divide what you will talk about into categories and inform the patient of these categories before you go into more detail about each bullet point. For example, you could say, there are three important things I want to explain. Firstly, I want to tell you what I think is wrong. Secondly, what tests we should do. And thirdly, what the treatments may be. So this is it. Now let's complete reading the information. Now, the use of categorization above helps to structure the discussion you will have so that the patient can understand what will happen next. When you go into more detail, you should use a technique called chunking. This is when you deliver information in chunks, pieces, leaving clear gaps between each piece of information before moving on to the next one. You may also find it helpful to use a technique that is called labeling. Labeling allows you to highlight significant information to the patient. For example, you could say, is it particularly important that you remember this? So this is it, just to use chunks or pieces just to make the information easier to the patient. Guys, I have only, let me say, I have less than 1 minute for the meeting just to be disconnected. So let me disconnect the meeting and I have to come back because I have to make this section just to be 2 parts. I think this is better. So guys, let me disconnect the meeting and I have to record a new video, which is part 2 about speaking section. Thank you so much.